Well, February is American Heart Month, a time when all people can focus, of course, on their cardiovascular health. And joining us now to talk more about how we can keep up with our cardiovascular health and some concerns and risk factors to keep in consideration. From Henry Ford West Bloomfield Hospital, he's their Director of Nuclear Cardiology and Cardiac PET at Henry Ford West Bloomfield Hospital. Dr. Karthik Ananthasubramaniam joins us on the Megacast. Doctor, thank you for being with us today.
Thank you. Thank you for the opportunity.
Appreciate having you on. So first off, February is American Heart Month, but what is the importance across the year, not just in the month of February, but day by day, month by month, year by year, of people keeping track of their cardiac health and maintaining a strong heart?
Absolutely. So not only in February, but as you rightly pointed out, throughout the year and for the lifetime, cardiovascular health is key, as heart disease remains the leading cause of people dying, both suddenly and due to chronic heart disease-related problems. So understanding the preventable ways that we can actually adapt our lifestyle to reducing our cardiovascular risk is key. And so obviously the February Heart Month is to highlight that, but really plays out throughout the year and in someone's lifetime. Absolutely.
So we know about some of the more common risk factors for heart disease or other cardiac issues, sedentary lifestyles, a poor diet, or a diet that's high in salts or in cholesterol or in certain fats can be detrimental to your heart health long term. But what are some of those other less common risk factors that can put somebody at risk for heart disease?
Absolutely. So I think you highlighted some key things. In addition, obviously, importance is diabetes, hypertension, being overweight, smoking, which is a big preventable factor, excessive alcohol use, and not being physically active. And you pointed out the other right things, being not having a good diet, etc. But we are learning more and more that there are newer risk factors for cardiovascular disease and things that we could actually control. For example, I would point out that there is very strong evidence that both physical and mental stress, both at work and at home, drives inflammation in the body and promotes cardiovascular illness and heart attacks. Similarly, lack of good sleep, restful sleep. As we all know, the body needs time to repair itself. So not sleeping and continuously working does not give us time for the body to repair itself, for the brain to get its rest. So in general, getting restful 6 to 7 hours of sleep is very important. Even more interesting are newer evidence to suggest that chronic noise and pollution, which we don't pay much attention about, but we are now getting more and more aware of environmental pollution, that we inhale these toxins, particularly living in very congested cities, traveling in cars, and inhaling all of that has been associated with inflammation. And then people with certain kinds of diseases like rheumatoid arthritis, psoriasis, or lupus and inflammatory diseases all stimulate the body's inflammatory mechanism and cause cardiovascular illness. So just some of the few important newer things to be highlighted.
And so in addition to that, you think of heart disease, and I think a lot of people think of it and the image of a person who has heart disease as maybe being a little bit older or being elderly, someone that maybe is overweight and hasn't been very active for very long. But heart disease can affect almost anyone. What are some of the common groups of people that heart disease does affect, and at what age can doctors like yourself and primary care physicians also begin to see heart disease becoming a factor in people?
I think it's a great question. Thanks for asking that. So yes, I think the myth that we need to dispel is that heart disease is a disease of older age. We now know very clearly that having a family history of premature coronary artery disease, meaning someone in your family before the age of 65 in men or less than 55 in women who have developed heart disease and or died from heart disease, independently increases the risk of people developing heart disease earlier. Women in general have been shown to have problems with the heart, which we typically believe that the myth has been that women don't develop heart disease till later in life. That's not true anymore. Women can develop chest pain, even in the absence of blockages in the arteries of the heart. due to what we call diseases of the very small vessels. That's called microvascular disease. And then people with all of these inflammatory diseases, many of whom are women, can develop similarly heart-based issues. So to answer your second part of the question is, I think just like we take our cars for preventative maintenance, those of us who take care of our cars, even if the cars are working well, we take them for preventive maintenance. So why would we not do preventative maintenance for ourselves? So starting at the age of around 20, I think meeting up with your doctor first, just as a routine cardiovascular health check, and every 5 years from there on, at least getting some updated blood work, including your glucose or cholesterol tests, etc., would give you a snapshot of where you are at a young age. So much so that I can tell you that the development of cholesterol in the arteries of our hearts and the arteries begin as early as 10 years old. So knowing that the disease has started early can help us take the right preventative actions rather than waiting for the damage to happen and then seeking help when we are 70 and 80.
And so then you mentioned taking some of those preventative actions early on instead of waiting for those effects of heart disease to become so damaging that you have to be treating them to maintain life. What are some of those interventionary tactics that are employed by medical professionals and, of course, by patients to kind of offset the onset of heart disease or to counteract the effects of heart disease early?
Absolutely. Great question. So I will start off with what we can do without any cost. That's the best way. So that's called what we call Life's Simple 7. That was proposed by the American Heart Association back in 2010 and still today remains important preventable actions that the community can take to decrease the risk of heart disease. Obviously, if we had the magic bullet where we could stop it completely, that would be great. But all we can do is to minimize the risk. So if you're a smoker, quit smoking. If you are into eating high-fat diet or fast foods, cut that back and incorporate more fruits and vegetables in your diet. If you're not moving and sitting most of the time, sitting is considered now the new smoking. So just sitting for long hours increases your risk of cardiovascular disease. So getting up and moving around, getting your steps in, and engaging in at least 150 minutes per week of moderate intensity activity would be important. Knowing your blood pressure numbers and maintaining your blood pressure, ideally in the 120/80 range, is important. Knowing your glucose, so that are you a pre-diabetic, meaning are you at risk of diabetes, is important. Knowing your cholesterol numbers, as we call know your numbers. So we encourage patients to go to the American Heart website, or for example, at Henry Ford, we have know your numbers where we can go easily plug in your information. But unless you know your information, you can't know your heart disease risk. So that's why finding out about this. And finally, weight. Knowing your weight, which is proportional for your height. That's called body mass index. And in general, even though it's not perfect, it's a good starting point to know the total amount of fat in your system and where you are with regards to your weight. Ideally, for Americans, you want your BMI, or body mass index, to be less than 25. And for Asians, the risk actually increases starting at 23. So keeping your BMI less than 23 is important. So these are the simple 7 which we can adopt on our own. Beyond that is discussing with the physicians when it is appropriate to get any screening tests, if at all, to be done. Obviously, the good news for the people who are very young is that even though they may have 1 or 2 identifiable risk factors for heart disease, it's not like they are immediately going to have a heart event, because the young age in general protects them, but they can take all the preventative steps and discuss with their doctor what they need to do to prevent that.
And so that not everybody is aware of some activities that they may be engaging in, thinking that these are beneficial to my heart, these are beneficial to my health, and in the long run, it will benefit my health as I age, as I get older, and as other risk factors come into play. What are some common activities that people engage in that they may not know are dangerous to their heart or may put them at risk for things like heart disease or other cardiac conditions?
Absolutely. I think I would say the leading one is basically snow shoveling, particularly in winter. It is directly related to cardiovascular acute events. So if you're not someone who exercises regularly, but even for those who exercise regularly, snow shoveling is profound increase in stress for the heart, because in the cold, the heart arteries constrict, your blood pressure goes up, and as you increase your blood pressure, you can have a rupture of some of the cholesterol plaques in the artery, which can then obstruct and cause a heart attack. So definitely snow shoveling is not good. Then recreational drug use. So as we all know now, it's so common for people to use recreational agents, just like marijuana or vaping and other things. Those are clearly long-term associated with cardiovascular risks. So though just getting away from smoking and doing vaping is not actually good enough, vaping has also been associated with it. In general, aerobic exercise, which means walking, jogging, running, or light resistance weights, is preferred to extreme stressful exercises like heavy bench pressing, etc. Not to say that they're not good to develop your muscle, but that puts profound stress on the heart in general, which can cause problems. So the best advice I would give is, if you're planning to get into an exercise program and you're someone who has never exercised before, it is good to meet up with your doctor, understand your risk, and get a exercise prescription which is safe for you to begin your activities.
We're talking with the Director of Nuclear Cardiology and Cardiac PET at Henry Ford West Bloomfield Hospital, Dr. Karthik Ananthasubramaniam, on the Megacast. It is American Heart Month during the month of February, and Doctor, we've read so many studies over the course of the pandemic, and so much research has gone into increase in alcohol consumption over the course of the last couple of years for a number of different reasons, of course, on alcohol abuse and misuse studies, but also, as you mentioned, that alcohol consumption can have a negative impact on the heart. In past years and past times, we've heard kind of conflicting stories that some moderate alcohol intake can be beneficial for your cardiac health, and then others that may say that any alcohol, even in moderation, can have a negative impact on the heart. What is the truth behind that? Is there a truth in both of those statements, or is one more truthful than the other?
Again, a great question and a challenge for the community to deal with, given the conflicting evidence. So I think in general, the cardiology community's take on it is that there is no threshold for safety of alcohol. So in general, alcohol has been associated with increased risk of heart rhythm problems. In moderate amounts, as you mentioned, there's definitely studies which have shown that the good cholesterol, which is called the HDL cholesterol, has increased, so that may give a little protective benefit. But continued consumption clearly is associated with heart rhythm problems, blood pressure increases, and higher heart-related events in the future. So the key advice that we give patients is, do not start alcohol just to get the beneficial effect, because taking no alcohol is always is the safest way. But if you are someone who has a habit of having some degree of alcohol socially, regularly, the Heart Association recommendations are, for men, no more than 2 drinks per day, and for women, no more than 1 drink per day, preferably that being wine, something like red wine, which has got a higher amount of antioxidants. But coming back to the first important point you made, you're absolutely right in that the COVID pandemic has all forced us into isolation, home-based work. And so we are all next to the fridges, and people have started gaining weight, eating unhealthy foods, and consuming more alcohol. And we've clearly seen increased incidence of alcohol-related liver complications and cirrhosis, which is damage to the liver as part of COVID pandemic, and the deleterious effects of alcohol on the heart, as we just discussed.
Doctor, before we let you go, any other heart health tips or information that we should be keeping in mind to keep our heart and our cardiovascular system healthy, not just in American Heart Month, but all throughout the year?
Right. Absolutely. I do. So I want to make a couple of points. Obviously, once you know your numbers and there is a likelihood that you may be at higher risk, it is best to look at potentially further clarifying risk. With regards to testing, I would say stress testing in general is not recommended if you do not have any symptoms, but there are newer tests available which can further clarify your risk. And so you should discuss with your doctor whether those tests are suitable for you. An example of a simple test, although not covered by insurance, but which is pretty cheap in general, about $100 or so, is a calcium scan of the heart, which gives us insight into the amount of calcium buildup, which can help to stratify risk. So definitely, seeing cardiologists, for example, we have centers at Bloomfield Township and Henry Ford West Bloomfield and multiple other centers where we perform and interpret these tests and are able to give screening advice to patients. So patients should take the chances of meeting up with their doctors and finding their risk.
More information on Henry Ford Health System's website, henryford.com. Doc, thank you for joining us.
Thank you very much.